everyone. So we're here today going to talk about plantar fasciitis and kind of some common things with it and how you can treat it. So what plantar fasciitis is, it's that big thick tendon on the bottom of your foot. A lot of us get it, especially when we get older. Our runners see it, or people that are really active will see these problems as well too. Way you kind of know you have it is if in the morning when you wake up and you go to get out of bed and you're trying to walk barefoot on your floor, if it feels like someone's jabbing sharp knives in the bottom of your foot, that probably means you have plantar fasciitis. Now typically plantar fasciitis, once it gets stretched out, you'll feel pretty good, but then when you sit down again for 10 to 15 minutes, you go to get up, you feel the pain again, you know you've got it. There's some simple things you can do to kind of help self-treat it. We use this thing called a foot roller. You can also use a racquetball or a frozen bottle of water will work, or even a can of something at home will work. But if you look at your bottom of your foot here, this tight tendon piece, if I pull my big toe back, that right there is your plantar fascia. If you pull it back and you run your finger along it like this really hard, if that hurts you or is really tender, that probably means you have some plantar fasciitis issues going on. So what we do is we just take this foot roller and put it on the ground, and you're just going to put your foot right on top of it, and you're going to roll it from the heel all the way to the ball of the foot. Now if you can see how much pressure I'm putting into it, you want to push pretty hard. There's not much when we tell people that this should hurt, but this will feel very uncomfortable and probably give you some owies and make you want to say some few choice words. But that will help break it up and get it really good for you. So about 2 to 3 minutes of this a couple times a day, and that'll help break up that tightness in this tissue and allow you to walk without that pain again. That, along with make sure you're wearing really good shoes at all times, especially when you're working out, and make sure you stretch out your calves, your gastroc muscles. That's the famous runner stretch you've probably seen everybody doing. When you come like this, you should feel a nice tight pull and that Achilles tendon up into that gastroc muscle. Make sure you hold your stretches for 30 seconds. Do 2 to 3 repetitions of those. If your foot's having pain, put some ice on it as well too. It's always good for it. And if you got any questions, please let Julie or myself know. So.